All right, so thanks for giving us a sneak peek ahead of all the analyst notes that are about to come out. I first want to start off with, how are drug makers, how's this industry, how are they responding to some of these Trump administration policies, specifically tariffs?
Sure. One of the things that's really struck me at this conference, and it's been an amazing time to have access to the nearly 500 companies here, over 2,000 investors. So you get a wide range of perspectives. And from a company perspective, in pharma particularly, I would say what has struck me is they really seem to be taking this in stride. Their view is this administration said it was going to be disruptive. The administration is being disruptive, and they're trying to stay very close to the situation. They're very engaged with the administration. I think there's a very open dialogue there. And so I would say first and foremost, they're tackling it by having a really open line of communication. And that strikes me as very pragmatic and constructive.
All right. So according to your notes that you sent us, a lot of these companies, they see this new administration and the idea of less regulation as being an opportunity. But where is it opportunity? Are there certain lines of drugs? Is it about developing new drugs? Is it about shortening the timeline to go from R&D to actual release? What's the opportunity here?
Yeah, that's right. So particularly for early stage companies, as biotech in particular, I think timelines and bureaucratic burden in particular really are a focus. And it's an interesting time now because for the biotech industry, which of course is very, very tied to Silicon Valley, there's now new avenues of dialogue with this administration that arguably we haven't seen before. And so I think there is a sense that, because there's an empathy for disruptive technology in this administration and what that can achieve. And then certainly, the very Doge themed, breakthrough of bureaucracy, that can also be applied to things like the clinical trial process and things like that. So can we optimize, human health outcomes, but do it in a much faster, cost-effective way? So people are very focused on that here.
So, Lisa, this is interesting. You say the healthcare industry, they're one of the few people, I guess. Everybody else was kind of shocked by the tariffs actually being released, but they were prepared for it. They were ready for it. But what about RFK as the HHS secretary? A lot of people saw it as a wild card. Do they still see it that way now that he's been confirmed?
Well, I think, 6 weeks in this world now, feels like a decade. So I think, that certainly has been well digested. And I think, as I say, there's a really direct dialogue there. And from what I understand, I think those conversations have been really constructive. So, for example, we heard from the CEO of Pfizer earlier this week that their approach, and I think this is very common across the major pharma players, is to really identify areas of overlapping interest. Where can we work together to a positive outcome? And so, when you look at things like diabetes, when you look at things like oncology, immunology, those are areas where I think there is a lot of common interest, chronic conditions. And I would say, too, that I think the MAHA, Make America Healthy Again movement is regarded as a big thematic within the administration that the healthcare industry can lean into, because that's what it's all about.
Yeah, I haven't seen the Maha hats yet. Haven't seen those quite yet. Lisa,
yes, that's a great idea, actually, for next year.
Lisa, you're giving us a sneak peek ahead of the notes. What are the top picks from the analysts from TD Cowen after this healthcare, or not after, I guess you guys still have one more day left, but coming out of the healthcare conference, give us just a quick rundown of the top picks.
Sure. Well, listen, I think that our picks are really the same, right? I mean, I think that, this is not a time to be, or it's a very difficult time to be a short-term investor. So we're really looking at long-term trends around innovation in major pharma. We continue to support AbbVie, who will be speaking at the conference today. In particular, they are very resilient when it comes to patent expirations. They're very, very strong in terms of their patent portfolio, which we really like. And they have a great history of at least meeting and often exceeding expectations. So we really like that in major pharma. And on the smaller cap side, we recently initiated coverage of Certara, which is a player in AI-enabled drug discovery. And we really like that because that's going to be a big theme.